Welcome, everyone. We're going to give it just another minute to allow for others to join, and then we'll go ahead and get started. Thanks for joining today. All right, I think we'll go ahead and get started. So welcome everyone to the 2021 Virtual SMA Conference. This is Jessica from Cure SMA's Family Support Department, and we thank you all so much for joining us for the Decision Making and SMA session today. We are incredibly grateful to our national presenting sponsors, Biogen, Genentech, and Novartis Gene Therapies for their incredible support of this year's Virtual SMA Conference. I did want to note that all lines are muted other than for the speakers during the session, but you can find the chat conversation tab located on the right-hand side of your screen. Please use this throughout the session. You can submit questions during the session, and then we'll have some time at the end for a Q&A portion. And now we'd like to introduce our speakers, Dr. Graham with Boston Children's Hospital, Dr. Parsons with Children's Hospital Colorado, Gina Santucci with Texas Children's, and Vanessa Batista with Children's Hospital of Philadelphia. Vanessa?
Great, thank you so much, Jess. Welcome everyone. Thank you for joining this session, and thank you to all of our speakers and panelists that are part of our session today. We're looking forward to spending this next section of time with you. And as you can see here, these are our disclosures for everyone that's a part of this panel. Next slide, please. And so our objectives for this workshop or section here are to really talk about decision-making in the context of SMA as we know it today. This is a topic that has certainly changed a lot over time, and you all probably know why, and that's because we are so fortunate to have 3 treatments now available for SMA, but in the context of new treatments also comes new implications for decision making. And what does that mean for individuals? What does that mean for families? And how do we as a team caring for individuals and their families, how do we navigate decision making? How do we help families decide what's best for themselves and for their other family members? What's the right thing to do? I say that loosely, the right thing to do, because there's not always one right thing to do, but our conversation today is really about that. How do we navigate what the options are? How do we think about the best way to make a decision for ourselves, for our families, for the people we're working with and that are a part of our community? And we hope that our session today will really be a conversation. We'll have some information to start out. Each person will give a little bit of background and provide you with some information. And then we want to really open this up to a discussion or a conversation around what you're thinking, what your questions are. So we invite you to send your questions in the chat, and we'll have plenty of time for discussion. But we really are going to explore specific situations in which individuals and families living with SMA are faced with decisions regarding these current options for treatment and care, and then to identify a framework that can be used to guide families and teams in decision making. So really a framework to think about how to approach this. And then we're going to go through some specific case examples to exemplify how to consider decision making in SMA. Next slide, please. And so I think we will start here with Dr. Graham and get our session going.
Thanks, Vanessa, and thanks, Jess. First of all, I want to introduce myself. So I'm Rob Graham. Some of the attendants may know me. I'm actually an ICU doc here in Boston. But my role with SMA and my involvement with Cure SMA has begun quite some time ago. I also run our home ventilator program here at Children's, and have been part of the SMA clinic since 2007. So as I think about decision making, it's both, as you know, in the hospital-based setting as well as sort of long-term continuity. And And I think, it's essential, first of all, as you're attending here, you clearly made decisions to engage in the Cure SMA community, and have probably already had to face a lot of decisions to get to this point. But I think what's essential, and Dr. Parsons will build on this with some specific circumstances, is that all of us have to make decisions as it pertains to our own health, our sort of activities of daily living, and anticipation of issues. And this really does apply to everyone. And I mean, when we're thinking about decisions, it doesn't matter whether you're newly diagnosed, um, you have an infant who is identified on newborn screen and are pre-symptomatic, or if you were previously diagnosed and have been part of, clinical trials in the past. And, now we're even differentiating pre-symptomatic versus symptomatic. So those who have been identified before they, develop weakness or other needs. If you're an individual affected by SMA, or if you're a parent or other family member, all of us are involved in these decisions, and I think it's helpful to sort of think of these really broadly. And I think we'll talk more about that. And then young adults or adults with SMA, the decisions you have to make about your own family planning, and actually currently I'm working with a young woman and her husband as they're working through a pregnancy. Is like, what are the type of decisions that they have to consider, first of all, to conceive, as well as carry through a pregnancy and otherwise. So this is quite broad, and I think it's not just about the treatments or trials or otherwise. Next slide. It is helpful to also realize that the decision making, as I said, sort of continues. This is, I borrowed this from Tom Crawford, prominent neurologist who some of you may know, and Kenneth Hobby also uses this. It just basically shows that we've had to make decisions as an SMA community for quite some time. As research trials, were brought up and failed, or just weren't as productive as possible. There's always been this hope. And actually, I sort of think we're nearing this point towards the right there, where you look at the frustration has continued, although the hope and hype are at a sort of a constant, that we now have these 3 treatments. And there are still more in the pipeline, which is great, but we are still frustrated by variability in response, or variability in access to things, or the fact that we don't have a cure, and that we are still sort of straddling sort of decisions around the clinical care. And so I think that's where we want to help give you a framework and go over some specific examples that might be helpful. Next slide. Yeah, is a changing, and what we talk about today, there may be specific things that may not be relevant next year, but I think, and Gina will go over this as well, sort of a general framework. How do we want to think about the possible treatments or combination treatments, and how does that overlap with ongoing research efforts? So, it is something that is challenging, and I think it's also helpful to recognize that each individual with SMA and their respective families are faced with different decisions. Next slide. It is helpful, when we're making any decision, and this, again, this applies as far as we're concerned to the treatments as well as any supportive measures. It's like, how is this going to benefit me? And that there are these sort of misconceptions or misestimations or optimism that, a given treatment will help me more than someone else, or disproportionate to what's been reported, or that maybe I won't have the problems that we've experienced with SMA if I undergo a given treatment or procedure. And so I think it's also, all of these are sort of natural. It's like we want the best for ourselves or our child or our family member. And so it's crucial to work with your primary teams to say, okay, as we're pursuing this, or as we're pursuing a decision about, is it a G tube? Is it a spinal fusion? Is it addition of one of the new treatments? What can we expect? And let's be realistic about this, and anticipate either side effects or benefits. Next slide. Again, being reasonable and prudent. I don't know if any of the attendees are from Montana, but years ago when I moved out from the West Coast to Boston, this was the speed limit. every family sort of, takes this differently. Reasonable and prudent, what it means to me may be different than what it means to you. And so I think it is helpful, though, to sort of gauge what's around you. Is it daytime? Is it nighttime? Is there a lot of traffic? There are lots of things that play into this. And so I think, reach out to your supports, whether that's primary care, whether it's your SMA team and any, any of the care centers, and then reach back to Cure SMA. I mean, as you've seen throughout the course of this conference, there are a lot of resources and a lot of people invested in making sure that, you do and your family members, have the best quality of life that you can. Next slide. And the fact is, as I said, it's a changing landscape. And one of the challenges we're faced with as we think about the cases that we're going to present is what we talk about today is difficult, and that it is changing. And that, as we've seen with the addition of treatments, is that how we conceptualized SMA in the past, and actually how your medical teams and surgical teams have conceptualized SMA in the past is different. You've probably heard, the different typing, types 1, 2, and 3 may not be as relevant. It's more a question of what can you do functionally. SMN2 copy number doesn't capture everything. So it's hard to, say, oh, this is what you as a group need. It's more like, what do you as an individual need, and how do we help you with that decision? Although, the enemy of good is perfect. This is something that you have to sort of think about in your decision making, is like, what are we adding or losing to any intervention, and how do we do that? And then, the fact is, research is still a big part of the SMA community. As you said, we don't have a cure, and so participating in research, advocating for prenatal screening, all of this actually plays into our decision making. And how do we continue with trials? What do we learn from the last trial, and what are we continuing to learn from the approved treatments? We don't know everything about what are the long-term, benefits or risks of these. And Dr. Parsons may be able to speak to some of that as well. Is that there is an unknown still, and so I think that's helpful to recognize. And then one of the challenges that I think we're all faced with is that there, for good or bad, there are only so many people with SMA. And what we might see is a little bit of a slowdown in some of the research trials at this point, because everyone's getting or sort of grappling for access to the treatments. And as a result, there are probably less people who are either open to or even just available for clinical trials. And so the next drug, the next treatment may be a little slower to come than we would expect. We've had the last 5 years have been dramatic. And so I think it's, and really the key thing is that keeping you healthy is the most important thing that you do. The decision making you make around interventions, whether it's hip surgeries or spinal fusions or what type of therapy that you pursue, it's all part of that decision making. Next slide. Everyone's on their own individual path. We have seemingly far more ladders than we do chutes nowadays, which is fantastic for those who remember the board when it looked like this. I think that's what we want to sort of help you with, is how to navigate so that we can get to sort of that end point. And so at this point, I'm going to transition to Dr. Parsons, who's a neurologist in Denver at Colorado Children's, and she's going to provide some sort of specific cases to sort of think about, and you can extrapolate how they might reflect your experiences. So thank you.
Thanks, Rob. So as Rob said, I'm Julie Parsons. I'm a pediatric neurologist at University of Colorado at Children's Hospital, Colorado. And I am going to raise just a couple of cases so that we can think about maybe how to approach some decision making. So if you can do the next slide, please. So case one is you're the parents of a healthy newborn baby girl. Your pediatrician calls you to say that your baby has been identified on newborn screening as having spinal muscular atrophy. You're referred to a pediatric neurologist the next day to talk about SMA and possible treatments for this disorder. So as this case, I have to say, first of all, we're faced with some very, very difficult problems and a lot of variables that both the medical team, so that I would need to know about, as well as the family would need to know about. So first of all, this case is fairly general. So you're the parents of a newborn baby, but do you have another child who has spinal muscular atrophy? Have you ever heard of spinal muscular atrophy and what that is? Um, do you have any experience with it at all? You've just had a baby, and all of us who are parents know that this is a very, very difficult time where physically you're exhausted, emotionally you can be exhausted. You have this beautiful child in front of you, and now someone's telling you that this baby has potentially a neurodegenerative disorder. This is really difficult for the healthcare team as well, particularly if we are coming in as healthcare providers who have absolutely no relationship with you as a family who is coming in, being asked to make some really, really difficult and challenging decisions. So in this particular situation, I think as you come in to speak with the healthcare provider about spinal muscular atrophy, in general, there's going to be an exchange of information between the healthcare provider and you as a family. If you've had no experience with SMA, this is going to be an incredible amount of education and learning about this disorder, about the potential treatments, about what we expect, about what the different types are. And as a provider, I would want to know what your experience is, what the family history is, more about the baby and whether the baby has had any symptoms or problems, what you as a family look at in terms of values and decision making. So there's a lot that comes into this very early encounter. I think we're asking a lot of families to be able to put an incredible amount of trust and have just sort of an amazing learning curve during those first few days when a diagnosis of SMA is given to a newborn. On the medical side of things, what I would want to know is, again, what is family history? Do you have experience with SMA? We would always confirm the diagnosis of spinal muscular atrophy genetically on that very first visit. And then, as you know, copy numbers become very important. We know that the copy numbers relate to what we would look at in terms of going forward with natural history, although it's not particularly or completely predictive of what a child would look like, but it helps give us information to talk about what we expect, and also to help us as healthcare providers to understand how quickly we need to move and to potentially provide treatments. I do have to make a mention about social media here because all of us go immediately to social media for information. And this is always a big, big challenge in these situations because there is sometimes very incorrect information that is online or from different Facebook groups who are well-meaning, who give advice and information online. And I would just say that in this very first part, when you're learning about SMA, it really is important to be directed to good sources and to be able to go to the facts. I do strongly believe in shared decision making, and Gina will talk about that just a little bit later. But what that means is that as a family and healthcare provider, that we try to make decisions together about treatment and about going forward with care for the baby. As Dr. Graham said, these decisions are really very individual, and they have to be based on medical information as well as family considerations and family values. So for instance, if this newborn baby, in this case, it says healthy newborn baby, but if this newborn baby has signs of weakness, has joints that aren't moving well, doesn't move the mouth very well, is having trouble breathing, that baby might be very, very severely affected and may have only one copy of SMN1. And the discussion and consideration about that baby would be very different than, for instance, a baby who is healthy and maybe has 5 copies of SMN2. So those medical facts and information are important. There is a tremendous amount of information to go forward with as we're talking about treatments. As you know, right now, we have only 2 treatments that are available for newborn babies, onasemnogene and nusinersen. Risdiplam is available through clinical trials for newborns, but the other 2 are approved for newborn treatment. So really understanding about these treatments, understanding about what we know and what we don't know about this kind of treatment is really important. And again, we're asking a lot from parents to have to digest all of this information in a very short period of time to try to help decision-making regarding treatment. But as a medical group, what we do and what we really think is important is to give the facts and the information about the data that we know, data that has been published, results of clinical trials, looking at what outcomes are, looking at the modes of treatment that are available. Some families will decide on one treatment or the other based on their ability to access medical care. We also have to ensure, frankly, the insurance groups, because as you know, these treatments are expensive. And so, how to pay for them and how we manage that is another factor that goes into deciding treatment. So I think in this particular case that it is important for family and providers to meet each other, to develop a relationship, to develop a trusting relationship, to be very transparent about what we know and what we don't know, and to be really free to communicate questions and fears and concerns that will be present as we're trying to make choices about how to treat this baby. I do think it's important as well to always have a kind of informed consent so that before a treatment is undertaken, that you as a family understand what the risks are and what potential benefits are. And again, most of that we get from clinical trials as well as from real world experience and data that we have that comes in all the time. But then also understanding what we don't know. And as Dr. Graham said, the long-term effects of some of these medicines we're not really sure about yet because we don't have 40 or 50 years of experience to know exactly what to expect. So both the medical providers and family have to make best decisions based on the information and the data that we have now. Maybe the data will change in 2 years, but we have to make the best decision for patient and family with the information that we have at the present time. And for some families, that might be not to treat their baby. For some families, the medical provider might say, I wouldn't treat a patient who has 5 copies of SMN2, maybe we wait and follow. And for some babies who have just 2 copies, if treatment is going to be undertaken, we want it to be done as quickly as possible, emergently, so that we are able to have the best outcomes. So there's so many factors that go into making this decision. And I think this, again, is a very, very difficult time in the newborn period to be able to make these choices and decisions. Will you do the next slide? So the next case is another more common case now, where you're a 20-year-old with SMA, you've been unable to walk and seated in a wheelchair since you were 4. In 2017, you were very excited to be treated with nusinersen and feel you've had a great response with improvement in arm, hand, and trunk strength. But more recently, you've read about risdiplam given orally on a daily basis, and you wonder if you should switch. This is not an uncommon scenario now with having a new option available. And I think some of the same ideas would come forward in making a choice. So if you're a 20-year-old woman, you would need to be thinking about reproductive risks. If you have a partner, if you're anticipating a pregnancy, you'd have to think about what some of the cautions are using risdiplam, which is on the label. that there may be some potential injury to fetus. So the advice is to stop the medication for a period if you're going to get pregnant. So thinking about that, what's the timing in your life? What is going on? Maybe you decide as a woman that this is a great idea. You're not anticipating a pregnancy for several years. And so maybe that's a good idea to think about that. If you're a 20-year-old man, there is a caution about potential fertility issues and problems with making sperm. And we don't have great data yet. We don't have anything in humans that says whether this is reversible or what the real issues are, but there's a recommendation to bank sperm if you're anticipating being a parent in the future. So that's something that is a real issue to think about. As a 20-year-old, that might feel a little bit more distant, but I think those are things that you need to consider. And then I think the other real considerations are, as a 20-year-old, you're the person responsible for making the decision. So you can call on your parents or friends or phone a friend, but really it's your medical decision about whether you want to change or not. And some patients would say, you know, nusinersen's been great. I've had a great response. It's wonderful for me to just go in a few times a year and have it delivered. I don't have to think about a daily medication. Why would I change if everything is working just fine? And another patient might say, you know, I have this kind of wearing off effect. I don't get all the strength from nusinersen that I feel I should. The spinal taps are horrible. I have incredible anxiety every time I have to go in and get one. I think I could manage taking oral medication every day, and maybe I would do better. So I want to see what would happen if I change. And I have to say that depending on payer providers and commercial insurance support, we typically have not had trouble with patients transitioning from one therapy to another. We haven't had a lot of experience yet with switching back if one of the therapies isn't as efficacious as the other. So considering about access to the treatment, I think, is something that is important as well. We don't have as much experience with the newer agent as we do with the older agent. So we don't have as much experience with risdiplam for long term as we do with nusinersen. On the other hand, the trials with risdiplam actually included older patients. And so we're getting some data on older patients or patients who have been treated with other agents prior. So again, this is a time where there's a lot of data and information that is changing and developing. And we have to always think about that and bring that in as we're trying to make decisions. So again, I think the foundation is to be educated, to communicate well with providers, as well as with understanding the clinical trials and the data that we have, and making certain that we are on the same page as providers and patients with what we know and what we don't know. And as Dr. Graham said, I think one of the most important things with any of these medications right now is to receive care from a provider or a team of providers with a specialty clinic who really knows how to follow patients with SMA, because it is very important that we continue to follow patients to be able to know what some of these outcomes are. Cure SMA has a registry that is helping to collect data as well, so that we can look over the long term to be able to go back and answer some of the questions that patients and parents want to have information about as they're trying to make these decisions. So difficult to make decisions when you don't have all of the information, but reality is we don't have all of the information to know. And I guess another point that I would make is that there are new treatments that are coming forward, and we're going to have more and more and more decisions that we will need to be making about adding on medications or potentially using different medications. So we're dealing with the excitement of having effective therapies, not cures, but effective therapies, and we will have more. So this practice at decision-making will continue on. I'm going to turn it over to Gina, who actually has some structure that she's going to review with you in terms of decision-making.
Hi, good morning. My name is Gina Santucci, and I'm a nurse practitioner here at Texas Children's on the palliative care team. And put the next slide up. I'm going to talk a little bit about decision making, and my role here as a nurse practitioner is really to, amongst other things, is to really help families navigate some decisions when given a certain diagnosis, or given they get information about their child, and how do they make sense of it. And many times, when I first meet the families and they're faced with a big decision, I often think about some decisions are really too big to make alone, and sometimes you need a team and to help sort things out. And Dr. Parsons talked about shared decision making, and I think about shared decision making in it's sort of in these kind of 4 quadrants, in which that the number one thing that parents have always, the information parents have always told us, is that they want to feel that they're being heard, number one. And so hearing what their story is, hearing what your goals are for your child, for your family, is really important. And in order to feel that you are being heard, we have to listen with the intent that I'm understanding what you're saying to me, instead of listening with how am I going to reply to what you're asking. And those are 2 different things. So really kind of being very present with families as they tell me their story, and the story that you share with your healthcare provider is very important, and it helps us help guide you of what path should we take. The next piece I think about is really the trust between the family, the child, and the provider, and that is based on the things that sort of, I think, help that along is the information that you're getting from the provider, is it consistent? Are you getting the same message from different people on the team? Sometimes families will say, well, I've heard from other team members, I'm getting a slightly different message. So the message has to be consistent. It needs to be the right information. You need to feel that the person who's giving you the information is competent to give you that information, and that information is shared with compassion. I think the other thing we look at that's so important in the beginning is, when I was talking about feeling heard, is what are the core values? Understanding core values and preferences are really a priority, because it really helps guide what is important and what is not. And it really is, it's almost impossible to align goals of care with understanding what your priorities are, or understanding what your core values are, what are your preferences. And when I speak to families, sometimes it's just one family member. There are more than one family member, and families want to get information. Not every unit receives information or wants all the information the same way. So I often will ask families, if there's 2 parents there, or there are 2 family members there, how do you like to receive information? Some families will tell me that I'd like to hear all the information up front. I like to go on the internet and get all that information, and then I want everything presented. Some families will say, I want to hear what you have to offer first, and then I'm going to make my decision. And so understanding how you want the information is so valuable in order to try to figure out which way are we going to go. And then finally, part of the shared decision making is making sure that we're getting the most up-to-date research, and then asking if some families want a recommendation and some families don't want a recommendation, and understanding where they are in that piece, in that part. Next slide, please. So decision making, and Dr. Graham and Dr. Parsons, really, this is a very dynamic process. it's, I think one of the things that I have certainly learned is that families make, there are decisions that we have to make emergently, and then there are decisions that we need time to gather all the information. And one of the things I think that really we try to help families is looking at what the goals of care are and what are the options, and trying to align what your values and preferences are with the options, managing what the expectations are. Because if you as a family say to me, well, one of the options for SMA, maybe one of the options requires frequent hospitalizations, and you say, it's really very hard for us as a family we don't live close to any major hospital, and it's really a hardship to come to the hospital. Well, that may affect which treatment choice you're going to pick. Looking at what's the resources that you may need to help support your decision, and are those resources available to you? And really talking with your healthcare team to see if they're not available and you need them, are there ways that we can help with that? Helping families understand the alternatives. I think many, it's wonderful that there are a lot of treatment options, but some families, I think, sometimes feel pressure that they need to pick something, and that they feel pressured that they need to make a choice and need to make a choice now. And so I think really giving families the space to say, what else information do you need? And it's okay that if you need to think about these are big decisions. What are families' hopes and goals? We have more than one hope for our child. And so looking at all the hopes that we have for our children, and how does that decision really will impact all of those hopes that we have? And being able to, once we understand that, realign what the goals of care are. So some of the things about when we talk about goals of care, I think, what's most important is minimizing hospitalization. These are just some of the things that we have heard from other families, maximizing quantity of life, or I want to maximize quality, minimize hospitalization. I want a treatment that will actually minimize suffering, or I want to make sure as a parent that I have exhausted all possibilities. And then the options, when we think about what's available, we talk about, are these treatments that will increase survival? Are they treatments that will improve function? There are treatments that may increase survival, but maybe we won't see the function that we want to see. Maybe there are options that are more invasive than other options. And so, as a family, you may say, well, I want the least invasive treatments possible. Like maybe you would decide that having something coming to the hospital frequently is not something you would want. And looking at side effect profile, maybe having the lowest side effect profile. When I talk about, I usually don't use the terms risks and benefits. I usually talk about what are the harms, potential harms and potential benefits. And then really have an honest discussion about if we're on this path and you choose this, have an honest discussion about if there are any trade-offs. If we choose this, what are the potential trade-offs that I'm going to potentially have to make? And then recognize with all of this that there is a certain uncertainty, and that it's such a dynamic process that families may say that feel that if they make a decision, they may be committed on this road forever. And I think it's important to know when you're picking a treatment choice, are you committed to that treatment, or will you be able to make choose other options down the road if something comes, if something new comes. And so having an honest discussion with your provider about that, I think is really important. Next slide. So some of this is so nebulous and out there that, when you're trying to think about, well, how do I do this? And so this is a tool that sometimes I use. I don't use it exactly all the components of it, but I found that it was the most helpful. And for families, and I'll go through it step by step. It's important that everybody who, all the stakeholders sort of participate in this tool. And so whoever is in the family that is important in the decision-making process, I think is important to also to go through this. And so the first part is really about clarifying the decision to make. And for SMA, maybe what treatment choice do I pick? And so we could literally, I think it's helpful to fill out, like, what are the options here? Option 1, what's option 2? If there's an option 3, fill that out. And then really talk about what are the reasons to choose this? And are there any harms if I choose this option? What are the benefits of this option? And write them down. And this is why it matters, because looking at it on paper and talking about it are two different things. And it's important that everybody does this so we can share the information. So after you pick out the options, I think you look at how much does it matter to me? Because maybe one of the reasons that this is a benefit is that this is a one-time treatment, and then I don't have to come back to the hospital. And that to me matters very, very much. Maybe another option is it's a great treatment that could have great results, but it would mean that I have to come back to the hospital frequently. And for me, that matters a lot, that I wouldn't want to do that. And if I had to tease out things, that would be something that would be really difficult for my family to do. And so kind of as we're moving across is, what are the reasons to avoid this option? And then be honest with yourself and about all the things that may impede you having, why you wouldn't want this treatment. And I think the reason why it's really important that you're honest, because some of the things that you may find is a reason to avoid. Maybe there's a solution to it that we haven't discussed or that you weren't aware of, and that you were worried about this, but maybe it's a worry that we can say, oh, no, we actually can help you with that. And then with the things that you are maybe should not choose this option, again, how much does that really matter to you? What's interesting about this is that when everybody in the family does it, sometimes you actually get a lot of different answers. And then you can talk with both parents or whoever are the caregivers there about, well, let's have more information about this. The second thing is, after you explore and rate your decision, whether positively or negatively, what support systems do you need? Do you need more support to make this step? And this is, who do you need to be there? Do you need to, some families say it's very important for me that grandparents are involved. Some families say to me, it's very important to me that my church community is involved, because I am very close to them and they have helped me throughout this whole process. And so really identify what support systems are there that you need that will help you make a decision. Once this is all done, you help families identify what they need to make the decision. Are there things that families sometimes get stuck on, like, well, I'm stuck on this part here, that I want to make this decision for this one treatment. It means that I have to come to the hospital frequently. I don't know how we're going to do that. And to really talk about what are the things that we can do to make that happen, if we can, and then think about next steps. I think that other considerations that we have to really think about is some families will talk about obstacles that they are having at the moment that may impede them from making a decision. And I think having an honest discussion, what is that obstacle? Is there a person in your family that is giving you a lot of information, or and that you're feeling a lot of pressure? Is there something else that you feel that is giving you pressure to make a decision a certain way, and you're really uncomfortable with it? Is it social media, which can be very helpful? And when I talk to families, I ask them to be really honest about what is it about social media? Is it helpful to be with social media, or is it giving you a lot of pressure that is making it difficult? And so once we tease all these things out, then we can kind of go back and look at the discussion, and these are all discussion points, the reason to choose, what it matters, why it's causing distress to you and your family, or what are the things that we need to do to help really figure out what is the path to choose. And then finally, if you choose a path, is it once and done? Or do you have the ability to change your mind? And I think for some families, they will say, well, if I choose this, am I married to this? And what does it mean down the road? And some of those answers, we can kind of tease out. Some of it is unknown, and being okay with uncertainty. And so this is sort of some of the tools that we have used about how do you plan the next step. Next slide. I think that might be all my slides. Yeah.
Thank you so much, Gina. We're going to go ahead and move into the Q&A portion. So I'm going to ask all the speakers to hop back on video, and then we'll get started here. Let me just add Vanessa. And then I think, Vanessa, you have the first question. So.
Yes, so thank you so much for that great overview. And we, as we mentioned, we really want this to be a discussion. So we welcome everyone's questions and concerns. And concerns are really just thoughts about any of the things that you heard. I think the first question here to start off would be directed at really any of you, but particularly Dr. Parsons, in what you were talking about with the different cases. And I'm just, the question is in regards to your thoughts on the question we all get about what should we do, and how you sort of handle that when someone like asks, well, what should we do? Or can you tell us what's the right thing to do for our child? And how you sort of handle the difference between giving somebody suggestions or advice on making the decision for their family versus telling them what's the right thing for them to do.
Yeah, and I will welcome everyone contributing to this, because I think this is an issue particularly when it's very difficult to make a decision, to basically put the full decision weight onto the medical provider and say, well, what would you do? Because they anticipate that that's the right answer. And I think it's really important, again, to go back to this model. Some of the issues that Gina was talking about and the framework is that there isn't a right one size fits all answer for all patients and all families in a certain situation. I think you really do need to go back to understanding what the goals of treatment for a patient are, and to be able to make that decision together. If it were easy to say, this is the prescription, this is exactly what we would do in this situation, then there wouldn't be questions about it. But there's so much that goes into making these huge decisions. These are big decisions that I think, again, going back to what's important, what is the data that we know in terms of outcomes, and really trying to stick with that in terms of making the right decision for a patient. I have to say that I've been dismayed sometimes, particularly through the social media shaming that families have experienced when they do make a decision that isn't popular, and that has been very, very destructive and very difficult for some patients in the SMA community, where a family makes a decision that they've gotten behind, they believe in, and then they receive a lot of negative feedback for that particular decision. So again, I would ask the whole community to respect each family with what it is that they have gone through, that process that they've gone through. And as Gina said, the other thing is that in the majority of situations, there's not a single decision that that's irrevocable. With gene transfer therapy, you can't take it back. So that one, I have to say, once you get it, you get it. But most decisions are not irrevocable. And so I think taking that into consideration, again, just having good communication so that you feel comfortable is great. But Robert, Gina, do you have a comment about that?
Yeah, I mean, I think it is very individual. And honestly, we don't have to go too far out of our daily living at this point to think about those decision makings. I mean, everyone is grappling with how do I resume my daily living with COVID at this point? And I mean, that is, again, it's a very individual decision. It's like, okay, I've been vaccinated or I haven't been. Again, that was a choice that people are making. And, you know, do I go back to the workplace? Do I send my child back into preschool or otherwise? And so, yeah, I think getting as much information as you can, it is an individual decision, and also recognizing that even within a household you may not necessarily agree. I mean, and I think that can be challenging, and that can actually be where, you know, your team can help, inform you as much as we can, but there will be an unknown. And I think the key is, yes, this isn't, as Julie was saying, irrevocable for most of these decisions.
I think one of the things that, I think it's important for families to know is that whatever choice you choose, you know your child the best, and that you are making a loving choice, and to trust that as a parent, that you as a caregiver, that you are getting this information, and the information, the choice that you're making. If you're in, when we're in. With our friends who are, or you have other families with, you're very friendly with other families, of course, who are other children who have SMA, and that because your decision may be different than another decision that another family would make who has a child with SMA, that know that your decision, you're making a loving decision for your child. And it may be a decision that's very different than your friend who has a child with a similar diagnosis. And I think that's the one thing that we really want families to know, is that, yes, you are their parent, and I believe that you're making a loving decision for your child. And that, and if you decide that it's going to change, we're going to support that, because there is no one size fits all. And just because, and as a parent, when we have children, we have more than one hope for our child. And as children grow and as time goes on, those hopes and goals may change and they flex, and we have to flex with them and support you, and give you the options that are available, and be very transparent with that for you. And I think that's the best that we can do.
Great, thank you. So I think we have time for one more question. And one that came in is specifically about the switch back and forth between starting some of these new treatments. And so the question is, say if someone is treated with Spinraza, but then wants to switch to risdiplam, but they switched and then they didn't like the side effects of the risdiplam and want to switch back to Spinraza, do they have to start over with Spinraza with loading doses, or start from where they left off? And I know that I've heard this question actually several times this week at the conference. So I know it's something that is asked a lot, but if you could shed some light on that in our last few minutes together here.
Yeah, I think there are a variety of opinions on that, frankly. I think, again, there's no one prescription that's going to be the right answer. And part of it depends on, if you've been on risdiplam for a year, you've had no exposure to nusinersen. So I would say in that kind of a situation, that reloading would make sense. There's a little bit of a different mechanism of action for risdiplam and nusinersen. If you've been off of the nusinersen for 4 months, then you still do have some nusinersen exposure through CSF to the motor neurons. And I would say that at that point, you would not need to necessarily have a repeat load. But again, it's going to depend on the length of treatment and how long the switch has been, as well as, again, I hate to keep bringing it up, but can you get commercial approval and insurance approval to do this in a timely fashion? Sometimes that takes a lot of finagling, and so you might not be able to just optimally switch when you want to.
Yeah, and I think the key with that is you have to stay engaged with your SMA care team. Like we need to be able to provide evidence that one is working or didn't. So, following with physical therapy for those assessments, or the person in charge of your respiratory care to say, oh, your pulmonary function is changing, or be able to really sort of build up with that and stay engaged, and they can help. You need that team to help you make that decision, but also then work through the pragmatics, which may be actually quite challenging.
Great.
Okay, great. Thank you so much for your sharing your thoughts, Jessica.
Yeah, thank you all. Thank you to our great speakers today. Thank you, Gina, Dr. Parsons, Vanessa, and Dr. Graham for such a great and informative presentation today, and answering these questions as well. We truly appreciate your time and being here with the community today. Thank you to everyone who joined in. There is a survey linked in the session page, and you'll also be receiving a follow-up email with that survey link, and we welcome any feedback that you have to share. Once again, we're incredibly thankful for the support from our sponsors for truly making the 2021 virtual SMA conference possible. And please join us for the last day of the virtual exhibit hall this afternoon from 1 to 3 p.m. And if there's anything we can do, you can always email us at familysupport@curesma.org. Have a great day, everyone. And thank you again for joining us for the 2021 virtual SMA conference.
Bye.
Bye.
Bye, thank you.